Hey everyone, Bridget here at the AAFE Training Center. We are just going to be doing some talks on my patient this morning. So as you can see, I am marking up her frontalis. So we are really trying to target her left side. It always seems to come back a little bit quicker than her right side. So I'm going to be doing a little bit extra over there. As you can see, I placed a few extra dots. I am then marking up her glabella. And then we are going to be doing her crow's feet, a little bit of a brow lift, and then her masseters. She's a big clencher and grinder, so we're really going to try to knock those out. And she also really wants her face to be slimmer, so that's going to kind of tackle both of those issues for her. So as you can see, when I'm marking up the crow's feet, I'm always staying outside of that orbital rim. And then when we are down to the masseters, I do like to do multiple injection points just because hers are pretty strong. So she tends to get a little bit of that fish gill, so I always like to do multiple injection sites on her. So biggest thing with the frontalis, I came up with her dose by looking at the set of her eyes. Obviously, you can see she's a little bit smaller of a forehead, and then also by how frozen she wants to be. So she wants to be pretty still. She doesn't like to have any movement. So those are kind of all things that I take into consideration when coming up with her dose. So as you can see, I'm going to start all the way at one lateral border and then come all the way across. The reason I make sure to treat all the way out to those borders is because if you don't, that's when patients tend to get a spocked brow. So that's one really important note to take, is to treat all the way out from your frontalis. There are certain patients that may particularly want that spock look, which is fine, then you wouldn't treat as far out. Now down to my glabella, I'm picking up and isolating each of those muscles to make sure that nothing is leaking down into the eyelid or into another muscle that I don't want to hit. For example, the frontalis. It runs right underneath of those corrugators. So I want to make sure that I'm picking up and isolating, and then I'm also watching my needle depth. When I'm in the medial corrugator, I'm going no more than 3/4 my needle depth. And when I'm on that lateral corrugator, I'm really making sure not to go more than half my needle depth. Down to the brow lift now, so I'm going to make her squint really, really tight, and wherever I see that orbicularis oculi pulling the most, that is where I'm going to go, because that's going to give her the best lift. Another point to note is that treating the frontalis heavily and then also trying to get a brow lift are kind of counteracting each other. So you're not going to get that great of a lift if you are dosing the frontalis too high, because they are kind of doing the opposite of each other and they're just going to even each other out. For the crow's feet, always making sure to point away from the eye and then always tucked into the eye enough where I'm not going to hit the zygomatic arch. Biggest thing with my masseters, now going down here, obviously I had said that I'd like to do multiple injection points, but I always make sure that I'm in the bulk of that muscle where the strongest clenching aspect is. I like to do kind of like one dose and then kind of divide it. When I am wiping all of the dots away, I'm making sure to wipe everything up and away from the eyes. So my frontalis, I want to wipe up and away. Everything in the upper face will be up and away. Then when you get down to the lower face for the masseters, make sure to wipe straight back, as you don't want to hit that risorius muscle and affect the patient's smile. Thanks so much for watching.